Hello, my name is Michael McCoy and I am the Senior Auditor for HITECH Compliance Associates. Today we're going to be doing your HIPAA staff training for 2025. Now there's lots of things going on and lots of changes, so I want you to know that this was updated as of October in 2025. Today we're going to hit three topics: the privacy rule, the security rule, and the breach notification rule for HIPAA. But we're also going to talk about information blocking, a new regulation that you may or may not be aware of that also impacts how you handle medical records in your office. Now, when it comes to HIPAA, documentation is key. So you always want to make sure that you've got the proper documents, including authorization forms. Those have 9 specific elements. If it's not documented correctly, it's not HIPAA compliant. If you don't know, give us a call. We'll be happy to help you with your HIPAA documentation. Information blocking, that new law I told you about, is any practice that is likely to interfere with, prevent, or materially discourage the access, exchange, or use of electronic protected health information. In other words, all that patient information you have in digital format. So the government came in and said where HIPAA permits you to share the records, information blocking requires you to, and we'll go over when you're now required under this new rule. Under HIPAA, we're always protecting PHI, protected health information, combination of an identifier matched with any individually identifiable health information, or basically your present, past, or future physical or mental conditions. EPHI just stands for that electronic protected health information, and SPHI goes into the sensitive protected health information, anything that could cause harm, either embarrassment to an individual financially, reputationally, or emotionally. Always under HIPAA is the minimum necessary standard. It is a key provision to HIPAA that basically states you should only be given the amount of access you need for your job purpose, which means only going into records you need for work, and also understanding that when you get a request for information, it also always be for the minimum necessary. Now here's a good way to get into trouble and even get fired with HIPAA, and that is if you abuse your access rights. So just because you have access doesn't give you the right to access. A good example would be your mom calls you and says, "Hey, I went to the hospital, I got a blood test done. Would you please go in and check the results for me?" Well, you have access because at the practice, your practice has access to that hospital portal, and you're on your mom's confidentiality worksheet. You also work in healthcare, so where's the problem? Well, HIPAA says that if you are not the provider for that patient, it is against the HIPAA rules for you to go into that. I will warn you that hospitals have real-time tracking of this information, and if you go into a record you shouldn't, they will call, ask for your HIPAA compliance officer, and ask for you to be terminated based on that access. So please understand, just because you have access doesn't give you the right to access. When it does come to access, though, you do as a patient have a lot of rights. So these are your rights and of course your patient's rights. And we're going to go through each of these individually. So first of all, the government put out this great little graphic that says, hey, you own the record, but the patient has full rights to access those records. They don't have to come in person, but that is one of their methods. They could email you, mail you, fax you, call you up on the phone, or go to the patient portal. That's one of the places where information blocking is going to become important, because the information blocking says that if the patient has access to the portal, you should be sending all information to that portal as soon as it's available to you. So in other words, no holding on to that information until the doctor has a chance to review it. That information under information blocking has to be sent immediately. How patients get their records, we're going to talk about that here in a minute, and then how you deliver those records. It's all the patient's choice. Just because they're your records, HIPAA gives the patient the right to get the records in the format and manner that they choose to honor that. So first of all, the patient gets all the records you have on them. So if you've put things in the sticky notes, hey, this patient can be a bear to work with, that's going to be accessible to the patient. If it's in that designated record set, they have access to it. Do understand that. And a change maybe for your office is that if you have incorporated records from other practices, you now have to provide those records as well. No, we're only going to give the patient the records we created. HIPAA says not anymore, designated record set. Now, I don't have to go pull additional records for the patient, but if we have them, I've got to provide them. And I've got to provide them cheaper. So HIPAA gives you two ways to charge for medical records. First, a flat fee, $6.50. That would even have to include postage. So if you go over $6.50, you must use a worksheet showing how you came up with those costs, and they have to be HIPAA-based allowable cost. We've put together this nice little patient records request worksheet that does have all of that plugged in for you. So here, all we have to do if we want to charge over $6.50, maybe it's 100 pages and they want it mailed, we can fill out this chart, put in those costs, and we can charge appropriately. Patients also get their records in whatever digital format you can create. So if I ask for my records on a CD and you don't have a CD burner anymore, then you can negotiate with that patient to do another digital format, maybe on a thumb drive or via email. Understand that we're going to talk about security here real quick. You cannot plug in a thumb drive from a patient, even if it came from another doctor's office. It's too dangerous. Thumb drives are easy ways for malware to spread. So work with your IT if you have to get into it, a thumb drive. But the best thing is if a patient wants their medical records on a thumb drive, you have to purchase that thumb drive, put the records on there, and then you can appropriately charge the patient for those costs. Email is another matter that patients have a right to get their records. Patients have a right to receive their records via email. Now, when it comes to emailing any patient information, it must be encrypted, with the one exception if I warn the patient these records could be seen or intercepted. Do you accept that risk? Patient says yes. That is the one time I can send unencrypted records with patient information to the patient. We've got this nice little warning that you can put on the email to the patient. Practices will tell the patient, we don't have email, so we can't send you your records via an email. The Office for Civil Rights has basically said that all practices are considered to have email, so you cannot use that excuse. Again, any other time you're sending medical records with patient information, you must use encrypted email. This is the one exception. Patients have a right not to have to come into your office to be verified. So if I want to get my medical records and have them emailed, I can call you up. You've got to make sure that you document that you asked your practice's verification questions. The most common ones I recommend are the full patient name, date of birth, and home address. And document that. I like using the shortcut VID. And now I can continue talking and process this patient's request. Can you be tricked? Absolutely. But if you document this, especially if it's emailed, then you are going to be fine under HIPAA because you've done what your required steps and you've documented them. When it comes to sending medical records to other providers, so this is not really a patient's third-party request. This is now provider to provider for continuity of care. And information blocking changes the game again, because now if I know you are a provider, so I've either referred this patient to you or it's in the chart or the patient has stated that you're seeing this other provider and that provider asked for records, it is information blocking if you ask them for a signed authorization from the patient. Cannot do that. But what happens when you get a request from maybe an out-of-town provider that you didn't know the patient was going to? Then I have to fill out a privacy exception form under information blocking. We have a full information blocking kit that you can get that'll have all of these forms in them and the training explained. But do understand that if I ask for enough authorization from another office asking for this patient's records, I have to fill out the privacy exception saying, I don't know that you're a provider. The patient hasn't informed us. So I must have an authorization signed by the patient, but first I filled out this privacy exception form. Critical that you do that. There are only a few other exceptions where you can deny access to the patient or to other providers, and we have them explained again in the HIPAA or the information blocking kit. You have up to 30 days to respond to those patient requests. So do remember that that is an outside time frame. You should always strive to get the records as soon as possible. Patients have other rights other than just getting access to their medical records and getting copies of them. They have the right to request that you amend the record. Your office has a duty to make sure that the record is accurate and correct. So you want to make sure that if a patient asks for something that would change known information in the chart, you're going to deny that. You're going to have to send the patient a letter telling them why. But again, just because the patient asks, your job is to keep the record accurate and correct. If you do agree with the patient, we never go in and erase records. This is using the amendment process to correct the information. You have a right under HIPAA to contact your patients. In fact, that's good health care. Calling patients with appointment reminders, letting them know their test results are in. Here we always want to apply minimum necessary if anybody other than the patient picks up. So if the spouse or significant other picks up, we want to leave that minimum necessary information. I'm calling to remind you that Michael has an appointment with us next Tuesday at 2. Fine. What's he coming in for? I'm sorry, you'll have to talk with your husband on that one. So do understand that we can leave messages, but it needs to be minimum necessary. Now, when it comes to talking with family and friends, that's another myth that we encounter quite often with HIPAA. And that is that if they're not on that confidentiality sheet, I can't give this person any information. Well, they came in with the patient. You can see them that they've involved the patient. Maybe they brought them back to the room with them. So if the patient has involved them, or you know that it's their son or daughter, you can talk with them about what's going on with the patient. So you're giving the patient medication. They need to take it 3 times a day, and they need to make sure to take food with it. The best way to do that is either to ask permission of the patient, may I go over these directions with your daughter, or just discuss it in front of the patient and give them the opportunity to object. Hey, this is my neighbor. He's just driving me back and forth today. I don't need him to know any of this information. Then, of course, we're always going to abide by those patients' requests unless there's a substantial and serious imminent threat of danger to that patient, and then we can override it. But without that imminent threat of danger to the patient harming themselves or harming someone else, we have to do what the patient says. Always use your professional judgment. I've never seen anybody get into trouble for doing what they felt was in the patient's best interest. So some examples: if you're in an emergency room, you may discuss the treatment in front of the patient's friend. If you're going to go into sensitive information, I probably would tell the patient and give them the opportunity to discuss it privately. Again, your sister's there and she's going to be driving you home from the hospital to the doctor's appointment. The patient needs to keep their foot raised. Then, of course, you can make sure that happens by telling their driver. Again, do it in front of the patient. Give them the opportunity to object. If the patient is incapacitated or unable to make a decision, then use your professional judgment in giving that person the information that they need. Remember, it's not a free-for-all. I can't go into past medical conditions unless, again, it's something going on with the patient at that time that you need to disclose. Understand that patients have a right to a notice of privacy practices. Another big change this year. The notice of privacy practices is changing, and you have to make sure that you update your notice of privacy practices. Again, if you don't have the 2025 version, contact our office. We'll help you get that version. But in that version, it tells patients that they have a right to file a complaint and that you will not retaliate against them should they file that complaint. You would much rather have the complaint come to you than go directly to the OCR, who's going to start an investigation on that. So now I want to turn our attention to the HIPAA security rule. Security is everyone's responsibility. This isn't just for the IT team. So you need to understand that no matter how secure your practice is by IT methods, you are still responsible to help make sure that the cyber criminals don't get in. Unfortunately, you're the weak link, because if they can use social engineering to trick you, they can bypass all that great security your office has. So we're going to go over the best ways to protect yourself at work and at home. So first of all, pay close attention to the return email address. We'll go more into that. Complex passwords, one of your best friends, and at work, only use the internet for work purposes. Again, your office should only be giving you the access that you need and making sure that you are properly trained with that access. Sanctions are a part of HIPAA, and if you violate any of the policies and procedures, you could be sanctioned. Now, why is it that the cyber criminals are focusing on healthcare? Well, the value of medical records, the value of locking up your computers and charging the practice ransomware, or getting access to those medical records and performing Medicare fraud using them, or identity theft, or any of the other methods that they have of converting medical records into cold hard cash. They use social engineering tactics. So we hear that word a lot, but what exactly is that? Well, it's taking advantage of human nature, of your niceness, of your understanding that, doing what authority figures tell you, validation, scarcity. These are all different methods that they use to trick you into handing over your credentials or helping them load malware onto your system. Understand that once they load malware onto your computer, they have full control. They can turn on the cameras, they can turn on the microphones, they can record your audio, they can watch you as you go into financial bank accounts and other accounts. Anything that you have access to, they have access to. So that's why we want to make sure that we understand how to avoid this. Well, we want to make sure that phishing, their number one tool, doesn't get us. We don't want to be caught. There are some great ways we can understand how to avoid phishing emails. They typically have a sense of urgency. Any email that asks you for personal information is suspicious. If it has a generic greeting, especially if it's coming from one of your vendors or coming from one of your accounts, they're going to put your name in there. Unsubscribe. This is a great one. If you did not subscribe in the first place, do not click unsubscribe. You've just verified that this is a good, valid email account. And I know you all are very valued at what you do, and that there are always going to be companies that want to give you more money. But these great job offers that you see on the internet, $10,000 a month for part-time work because we're in some other country and it's worth it for you to do that. You can even keep your own real job. If it sounds too good to be true, it probably is. And cyber criminals love to take advantage of natural disasters. Don't you want to help these poor people? Yes, you do, but go directly to the websites. Don't click on any of those links. They love sending you something from the IRS. What's more scary than that? I better pay close and quick attention to it. Always check the return email address. In fact, you need to be an email detective. We call it the perfect phish. And again, the cyber criminals are getting better and better. The perfect phish is one that spoofs your email address or one of your known vendors or maybe somebody in your company. So there are things to do to look for these phishes that now look much, much better. And with the advent of AI, they're making them look much better as well. Understand that anytime you get an email that has an attachment, has a link in it, requests any information, or has a QR code, you want to do a 4-step email inspection. So don't be multitasking. First of all, look for, does it raise your curiosity? Does it have a sense of urgency? Is it that IRS panic? Those are all clues to stop and do this 4-point email inspection. So first of all, we're going to check the sender's email address to the letter. I've seen them come in from Bank of America with just an O left out of it. So if you didn't read it very carefully, you would have missed that. A lot of practices now, just in case something gets through and your email at work gets spoofed. In other words, they're using your boss's real email address. They have attachments that say, on that email, this came from outside the organization. So it may be your boss's email address or the doctor's email address, but it said it came from outside the organization. You want to make sure that you do not click on any of those things or give out any information. 2, match the links. So if the email has a link in it, put your mouse over it, a little cursor. And if that cursor doesn't match where it says it's going, or if you can't figure it out, best not to click. In fact, I always like the policy, no clicking on links. If you have a link that you need to follow, go to the link that you know independently of that link on the email and go to that spot. Read the context, confirm the context. So it's not good enough just to look at the return email address and to check the link. you've also got to read it. And again, if there's that generic greeting, that's a big red flag. If it's urgent, again, I'm going to stop and slow down before doing what it says. And then confirm the context. So the office manager is asking you to run out to Target and get a $300 gift card for a meeting that's coming up. Is that normal? Probably not. So again, I want to use all of this to look at it. Literally 30 seconds of inspection could save your practice $5 million. That is the average cost to a small practice of having a ransomware or breach of all of your patient records. Think before you click. Again, a great policy is to just not click on links that come in emails. Too dangerous. Make sure you report all these suspicious emails. Again, one of the things that is kind of out is grammar and spelling. Why? Artificial intelligence can craft emails with perfect spelling and perfect grammar. That used to be a big thing to look for, not anymore with the advent of AI. So common phishing emails, those job offers, fake invoices, you won a contest. I don't remember actually doing that contest. Well, bank requests, special offers, always check things such as the time of arrival. So it came from your office manager, came at 3 o'clock in the morning. Well, that's not the time my office manager would typically send me an email. What's the tone? Are there any unexpected attachments? My physicians never sent me documents to review before. Again, is there that sense of urgency? Is it too good to be true? And are they using just that generic greeting? So let's look at these real quick. And these are some sample phishing emails. Bank of America Business. I look at the return email address, always the one in parentheses. Group Pharma at grouppharma.com.ec. Not coming from Bank of America. I am not going to respond to this. They want me to download that attachment or open it and see what's going on. No. Sense of urgency, members contact member services to reactivate your suspended account. Also, another thing in the return email address, the .ec, that is a country code. The 2 initials after the .com, this is actually going to Ecuador. So again, no multitasking when you're working on email. You've got to pay full attention. Here's a great one. I almost fell for this one myself. Coming to me at HIPAAComplianceKit.com. But I see the real return is support@coppola.com. That's not my company that handles my email, so that was enough. But if I didn't look at it closely, there's the Dear MM, the generic greeting. Just use the first 2, the beginning of my email address. Here's the key. Keep the same password. Well, if I click on this right now, I'm not going to have to change my password. Nobody wants to do all that. So by doing that, it's going to ask you to put in your username and your password. And as soon as you do that, they've just stolen your credentials. So again, look at the emails closely and you can see even the very good ones have clues on them. Here's another great one, that invoice from PayPal. I can guarantee everybody listening to me has gotten these emails. And this is a very deceptive one, but again, look at that return email, shankramail@gmail.com. I know I don't need to spend any more time with this, but again, generic greeting, dear customer. What they want you to do here is call this 800 number. And if you didn't call the first time, they're going to send out a follow-up email a week later and say, hey, if you didn't buy this Bitcoin, we're going to give you one more chance. So you call that number. Hey, this is PayPal. Mr. McCoy, thank you very much for calling. Didn't purchase this? Well, Mr. McCoy, you may be a victim of fraud. I can't help you with that, but you bank with who? Bank of America? Great. I've got their fraud person online for when these calls come in. Let me transfer you to that Bank of America fraud representative. Hi, this is Bank of America fraud. How may I help you? Well, Mr. McCoy, we will look into this for you, but I need to verify that this is you. Please give me your username. Please give me your password. Mr. McCoy, I really need to verify that this is you. I'm sending you a multi-factor code, an MFA code. It'll be 6 digits long. Please give me that when you receive it. In real time, they are in your account. You just gave them the MFA code, and they can now rob you of every penny you have. So do understand, nobody legitimate will ever ask you for your password or your MFA code over the phone. So here's another couple of good ones. USAA. Look how good this looks. If I wasn't a USAA member, I might want to fall for this. But again, the generic greeting. But again, let's go up to that return email address. USAA.customer.services@mailcenter.secure.com. Well, it doesn't say at usaa.com, but it does have USAA in the address and mailcenter.secure.com. Well, if you Google that, you'll find out that that is a known cybercriminal's email address. So it looks very good, but no, it's not. So do understand they can look much better now, but you have to be more careful. And then the one to the right, get paid to use Facebook. I'm on Facebook all the time. I, of course, want to do that. Again, what they want you to do here is send them your resume with all your information. Send you back a nice little email that says, we've decided to hire you. Please send us so that we can put you on payroll, a front and back of your driver's license, and front and back of your social security card. Again, they're going to start doing identity theft on you right away. So here's one that's going to scare you right away. Hey, you're being sued. Well, what is this? Again, looking at the return email address, Florida Court DocServe1 at postfpb.com. I don't know what all that is, but I do know that the courts are never going to send you that you're being sued through the email. Here, you've got something that's very scary. You want to find out what's going on. What I would do is call, and here it tells me down at the bottom, the Florida County Circuit Court. I'm going to call them if I need to verify this or if I have any questions to it. Now I want to change over to passwords. Passwords are actually going away, but they're still one of your best defenses if you're just using a password. So do understand, the main focus of phishing attacks is to get your password. You need to have a complex password to be able to protect your password. Again, AI steps in. AI can compromise or crack an 8-character password, upper and lowercase, 2 numbers and a symbol, in less than a second. So you need to have to be safe. The government's recommendation now is 60 characters minimum, upper and lowercase letters, 2 numbers, and at least 1 symbol. And I'll show you just real quick at this place called Password Monster. 11 characters. They could crack it in 4 hours. I changed that to 16, 203 years. And length when it comes to passwords is critical. Do use password managers. That's a great way to store them. You don't have to change them every 90 days now, unless it's your company practice. Every 180 days is the government recommendation. Do not use the same passwords at home and at work. Never write your passwords down and keep them close to the computers. Don't share them. When you have the opportunity to implement MFA, multi-factor authentication, that's the best. That is coming in a future HIPAA rule that you're going to have to use MFA for all access to patient records. In the meantime, you're probably starting to see a lot of places wanting you to use a passkey. A passkey is faster, safer, and simpler than passwords. And I predict by the end of the year, at least early into next year, passwords are going to go away. Passkeys are going to be it. How can a 4 or 6-digit PIN be more protective? Well, when it's tied to a passkey, it's actually locked to your device, and the website or the site that you're going to, it's actually putting a separate lock there. Those 2 locks have to match, and without that, it can't be done. So a lot of times it'll be using ID or a fingerprint, and then always having that code as a backup. And that way you will find faster and easier access. So passkeys are coming, and we just want to tell you a little bit about them. At work, understand that it is too dangerous to go on to other websites. So at work, only use the internet for work purposes. No going to your own personal emails, no shopping, celebrity, or social media. It's just too dangerous. Phone security, being a victim of a smishing attack. So I am sure all of you received and paid your notices that you didn't pay your tolls. Well, I know 4 people now that have. They all lost every penny in their bank account. This is a new way to get you to get their malware onto your device. In this case, it's onto your phone. And as soon as they've got on, they can now see when you go to use your banking, or they can connect to your network when you go home and connect, or at work if you connect to the company network. So be very, very careful of smishing attacks. The ones that I see that are the most effective are the curiosity. Hey, what are you doing tonight? It's coming from a number I don't know. Who is this? Do I have a secret admirer? Don't let curiosity get you. Security measures, if you're a work from home person, make sure your computer is secure. Patch, update your computer. Restart your computer after each section. So in our HIPAA Compliance Kit, we've got a full list of the measures you can take to make sure that you are safe at home. And so we highly recommend that you do that. But safety, just because you're working at home doesn't mean you don't need to be safe. I also want to remind you that as a HIPAA compliant office, it is required that your office manager or HIPAA compliance officer review your activity. The government says basically you need to review even the legitimate access looking for unusual or suspicious activity. So Big Brother may be watching you and looking to see what you're accessing, not because they're curiosity, but because the law requires it, and it requires a monthly report. Another reminder to the office staff is that you have to be very careful with social media. You should never respond to social media posts. If you need to, contact our office. We can help you craft a policy and procedure. But the average fine is about $30,000. Doesn't matter how much information the patient put up. They could put up their entire medical record. Doesn't matter. Once you respond and acknowledge that they're your patient, you've made a $30,000 fine. Breaches occur in HIPAA, and there's a whole rule, the federal breach notification rule. And it basically says that if somebody sees patient information that didn't have a medical necessity to do so, in other words, a violation of minimum necessary, we have to report it. Common breaches are faxes sent to the wrong doctor's office, a patient giving a record and maybe somebody else's prescription got stapled to the back of it, employee snooping, and improper disposal. Remember, a breach could be of paper records as well. Whenever that happens, we are required by federal law to fill out a form with these 4 questions. These are required by federal law. So if you don't report it to your office manager, you think you handled it, no, always report it, even if you solved it. Office called, hey, this isn't our patient. Oh, sorry, I meant to fax that to another office. Would you please shred it? And I'll get it to the right office. You did what you're supposed to do, but you still have to report that to the HIPAA compliance officer. No ifs, ands, or buts on that. Now, in the office, you do have incidental disclosure. Other patients are going to overhear other patients' information. Just going to happen. Or they're going to see patient information. So in your office, you should have a clean desk policy. That means that if I'm not working on that patient information, it shouldn't be on my monitor. If I've got paper records and I'm not using them, they should be turned over or have something put over them. So real quickly to finish up, I want to go over Medicare fraud and abuse. And Medicare fraud is when you are intentionally ripping off the government. Take that very seriously and put you in jail for lots of years and fine you millions of dollars. I know that none of your offices are doing this, but you may be involved with Medicare abuse. Medicare abuse is when we unintentionally make a mistake and bill Medicare wrong. So we still want to correct that. We want to be part of the solution, not the problem. So if you do suspect that something is being billed incorrectly or that we overcharge for services, make sure you bring that to the physician or your office manager or your supervisor's attention so that they can get that corrected. We do have the information here to report any suspected fraud or abuse to the OIG. I want to thank everybody today for attending. Hope you learned a lot. And if you'd like to get a certificate, we will happily send you a quick quiz to fill out. Once you do that, we'll send you a certificate of your training. So if you're working for a healthcare entity and need training and proof of it, we'll be happy to help you with that, no charge. Also, you can request our HIPAA Essentials, the companion booklet to this training. If you are a HIPAA compliance officer or would like to become one, we have a complete compliance partner program that we'll be happy to tell you about. Again, thank you for your time today, and we hope to hear from you soon. If you would like to get more information because you don't feel your office is fully compliant, we do free reviews for you. With that review, we're also going to give you that updated notice of privacy practice, again at no cost. So a free 30-minute consultation, or even if you just have some HIPAA questions that you want to go over and haven't had a resource, we're happy to go over those with you. But basically, our services are helping you put together your risk analysis, and then from that HIPAA risk analysis, building the rest of your compliance plan, complete with documentation. So again, my name is Michael McCoy. My information's down here at the bottom right, and we'd be happy to talk with you. So please send us an email. Thank you.